Hi guys. So let's start with the question of the day. A 14-year-old boy, accompanied by his mother, presents to the neurology department with complaints of frequent dropping of things in the morning time. You diagnose this case as juvenile myoclonic epilepsy and start the boy on a drug. The same drug causes hepatotoxicity if given to neonates in high dose. What is given along with this drug to prevent hepatotoxicity? A. Pyridoxine, B. Carnitine, C. Sodium bicarbonate, D. Folic acid. So, in this question, you have already been told that this is a case of juvenile myoclonic epilepsy. And we all know that the drug of choice for juvenile myoclonic epilepsy, it is sodium valproate. So now we have to think what is given along with this drug to prevent hepatotoxicity if given to neonates. So let's study some few points about juvenile myoclonic epilepsy. So juvenile myoclonic epilepsy, as the name suggests, juvenile, it is more common in adolescent period. So there's a history of you will be given a history of 14-15-year-old boy. The seizures are precipitated by lack of sleep. So it presents very early, that is in the morning hours while the child is getting ready for school. So he may, or eating his breakfast, so he may drop things. Physical examination is normal, good prognosis. Now this is a very important statement. It is a PYQ. Sometimes it is given in the question itself that there is bilateral 4 to 6 Hertz polyspike and wave discharges is present with frontocentral predominance. Drug of choice, as already discussed, it is drug of choice. Drug of choice is sodium valproate. It is a broader spectrum anti-epileptic drug. It is also given for migraine prophylaxis, bipolar syndrome. It is a frontline drug for acute mania, and also one more important point, it is a drug of choice for refractory rheumatic chorea also. So now the more for anti-epileptic drugs, side effects are more important. So we all know this famous mnemonic valproate. We learn the valproate drug by the mnemonic valproate only. From V we have vomiting, A we have alopecia, L, the question itself, it means liver toxicity. So in neonates, the carnitine availability is very less. So free radical injury can happen. It can cause hepatotoxicity. Ammonia can increase, can even lead to encephalopathy. So we avoid valproate in children who are less than 2 to 3 years of age. But if it has to begin, it is given along with carnitine. From P you have pancreatitis and PCOD. So why PCOD? Because estrogen metabolism is decreased while taking this drug, so it can also cause PCOD. R is for rash. O, obesity, weight gain happens with anti-epileptic drug. A, ataxia, that is cerebral ataxia. From T, tremors, teratogenicity, also thrombocytopenia can be seen. From E, it is an enzyme inhibitor. Valproates. From S, sedation. We all forget this, it should be valproates. The most common side effect of valproate is actually sedation, as it affects the RAS system. Now this is a PYQ. This photo is given and it has been asked that a mother is given some anti-epileptic drug in the during her pregnancy time. So which drug is given which can cause neurological side effects like neural tube defects by spina bifida? So the answer is valproate. This is a PYQ. Now coming back to the question. So the drug, what is given along with this drug to prevent hepatotoxicity? So answer is carnitine for sure. Now we have to see the other options. Pyridoxine, that is B6, vitamin B6. It is given along with isoniazid. Isoniazid, it is a first line drug for treatment of TB. So pyridoxine is given with isoniazid. It helps to prevent peripheral neuropathy. Folic acid, that is vitamin B12. It is actually given in pregnancy to prevent neural tube defects. So the value is 500 micrograms. It is given to all the pregnant females. Now sodium bicarbonate. Sodium bicarbonate, you all know that sodium bicarbonate, this is also a PYQ. It is given to those drugs in which you need alkalinization of urine for the excretion of those drugs. For example, like TCA, salicylates, So this is given. So you should all know the antidotes of the drugs. Drug toxicity, you should expect one question from this topic, drug toxicity. So this is the question for the day. So for anti-epileptic drugs, you should all know about the side effects more. Thank you guys.